I would say that our whole family definitely enjoys the beach. It's part of our blood. I've grown up at the beach. I'm 35 years old. I live in San Diego, California. I'm married with a 3-year-old son. And my family and I, we really just love being active. Most of all, we just enjoy our time as a family. My name is Lisa Facciola, and I've been living with hereditary angioedema. My HAE story started long before I was born. HAE runs in my family, many generations. My mother has HAE.
My father was sick, but we had no idea what it was.
Hereditary angioedema is a genetic condition, and most cases of HAE occur when there's a change in a gene that produces a protein called C1 esterase inhibitor, or C1 inhibitor for short. When that protein is deficient, it sets off a chain of events that ultimately lead to recurrent swelling episodes. The most common is skin swelling. This swelling is not sort of there for a few hours and then gone. This is swelling that lasts on average 2 to 5 days and can be very, very severe and painful and debilitating depending on what location is swelling.
I was about 10 and I started having these mysterious swellings. My lips would swell, my whole head would swell like a basketball, my hands would swell, my feet would swell. And then in my early 20s, during a stressful period of my life, I began having stomach swellings weekly with extreme pain, nausea, and vomiting.
So the intestines can swell up spontaneously, again, sometimes for days at a time. That leads to tremendous pain, also symptoms of nausea, vomiting, diarrhea associated with those abdominal attacks. And then the third major symptom that people with HAE suffer is the airway swelling. If that becomes severe, is life-threatening and fatal because it will close off the airway if it's not treated effectively. One of the difficulties with HAE is that it's largely unpredictable. So many of these angioedema attacks sort of come out of the blue.
When I turned 40, I had a throat swelling. My throat started closing and my husband rushed me to the emergency room. And they immediately put me in the ICU and intubated me for 4 to 5 days, which saved my life.
My mom had lived her entire life with unexplained bouts of swelling. It wasn't until she was in the hospital and fighting for her life that we were connected with a physician who ran the blood work that came back with a positive HAE diagnosis. And as a result of my mother's diagnosis, I had blood work done, and that was when I found out that I also had this inherited disease.
When I found out that my daughter tested positive for HAE, it was devastating.
Being diagnosed with a chronic disease isn't easy. You realize at that moment that this is not going to go away. I had my first attack, I think I must have been about 12 years old, and I was at a sleepover. I was at my friend's house, and suddenly my stomach started to hurt. And it was a pain that I hadn't felt before. Within hours, I was vomiting uncontrollably on her bathroom floor. My parents were called. I was taken immediately to the Children's Hospital here in San Diego.
One of the difficulties with HAE symptoms is they can mimic or appear like many other conditions. And that's particularly true for the abdominal symptoms, which can often be mistaken for appendicitis or a gallbladder problem or a gastric ulcer. HAE tends to worsen during the adolescent years during puberty, and the reasons for that are not entirely known, but there are some triggers that we know will cause or exacerbate hereditary angioedema attacks. One of the big ones is trauma that occurs in everyday life, even things we like to do. Many people historically have had difficulty with physical activities, working with heavy machinery or something that vibrates or causes pressure on your hands or your feet. Even sitting for long periods of time can cause attacks. Another big thing we caution people about is certain medications that can actually trigger HAE attacks. There's a blood pressure medication or a class called ACE inhibitors that we know will cause tremendous worsening of HAE symptoms. So we have to be a little bit careful, not only in the medical setting, but sometimes people have to pay attention to what they're doing in their personal life, their work life, their hobbies.
Something as simple as riding a bicycle would cause my buttocks to swell. Roller skating or ice skating or walking too much would result in a foot swell to the point where you cannot use that part of your body. But one of the most uncomfortable areas to have swelling is in your face. Swelling in your face can occur anywhere from your mouth, your eyes, your forehead, and it's incredibly disfiguring to the point where your eyes are swollen shut. Your lip is incredibly disfigured, and it was embarrassing and very difficult to go out into the world with.
Based on the research that's been done, we think there's 3 types of hereditary angioedema. The C1 inhibitor protein deficiency, dysfunctional C1 inhibitor, and hereditary angioedema with normal C1 inhibitor.
My mother and I both have low levels of C1 inhibitor. So our diagnosis was HAE type 1. That means that our body does not produce sufficient amounts of C1 inhibitor.
At the time I was diagnosed at 40, there was unfortunately no medicine in the United States to treat hereditary angioedema.
We really had very limited treatment for HAE. We had androgens, which are anabolic steroids, which can help to prevent attacks, but have always been plagued by side effects. And if people came into the hospital with a severe HAE attack, we could manage them with pain medicine. We could give them plasma infusions, which sometimes would help break the attack, but also had significant risks. Mostly, we would just try to support people until the attack went away after a few days.
I was in and out of the hospital for over 4 years and became extremely depressed and hopeless. Our family calls those the dark years. It was a very, very difficult time.
But with darkness, there is light. And eventually, we were notified about a clinical trial that was investigating new, modern therapies to treat HAE. So my mother and I enrolled right away. For the first time, it offered us hope for our future.
The most important thing is having an effective medicine to stop an attack. And we need every person to have that because anybody could have a fatal airway attack that needs to be treated or a severe abdominal attack that's debilitating. In addition to having something to stop an attack, is there a medicine that makes sense to use to prevent the attacks?
Today, I'm on a preventative therapy that prevents my attacks from happening altogether. It has enabled me to be a loving and predictable mother to my son. It's enabled my husband and I to not fear the unpredictability of an attack. Which was super exciting. So it's enabled me to do strenuous activities that before I would know would cause an attack, and it's really changed my life.
That being said, we still have a ways to go in terms of getting where we'd like to be with HAE management. There are some exciting things going on looking at new treatments that may be safer and more effective that will basically prevent the attacks from happening. I think we're moving into an era with HAE where we're not having to make people modify their lives and the choices in their lives.
Growing up, I felt alone. I struggled internally knowing that, I couldn't go to my friends for support. They just wouldn't understand what I was going through. And the first time that I met someone else my age with HAE was at an HAEA patient conference.
Patient advocacy groups have been an enormous benefit. In the United States, we have the US HAE Association, which has really been a driving force to connect patients, unite them so that they can recognize, hey, I'm not the only one with this condition. And that support has been of huge benefit to people with HAE.
I worried that I would never have a family, that I would never have a husband. And I worried about what my future would hold.
If you're facing a rare disease, there is always, always hope. Never give up hope. I did, at one point, almost completely give up hope. And now here I am, 20 years later, living a good life.
Today, my HAE does not play a huge role in my life. I know. Medication prevents my attacks from happening, so I get to live now a life unrestricted by HAE. And it's a beautiful thing.